So this is a video for patients who are considering or have made the decision to move forward with getting their labrum and their shoulder repaired, right? And so this is a surgery that I am quite familiar with because I've done it many times, close to 1,000 at this point, but also have had it in my own shoulder, right? I've had labral repair surgery in my own shoulder twice, actually. So I know exactly what it feels like. And patients ask me sometimes, how is it? And my shoulder's great. I love it. I can work out. I can do all the things I want to do. Most importantly, I can operate, do surgery without having pain in my shoulder. Play golf and do all that stuff, and it feels very good. So I'm glad I had it done. And it's nice because when you become the patient as the surgeon, it deepens your insight into these things. So I just wanted to hit some of the high points and some of the questions that we get, and try to go over them in quite a bit of detail. So that way, when you come into the operation, you feel completely informed to know exactly what's going to happen that day beforehand and then moving forward. All right. So talking about initially, so once you choose to have the operation, we'll get everything scheduled, set. You'll talk to our schedule. We'll go over the insurance information, and we can give you some really detailed information about pricing. You'll make an appointment. You'll come in. You'll see typically my associates, my physician associates, and they'll get you your sling, which will get fitted. They'll go over all the medications, all the pain medications we take, and we do a tiered set of medications. And then we'll answer any general questions that this video doesn't cover. And I strongly recommend you watch this video before that appointment because it should answer most of your questions. So just kind of going down the line. So what are some of the restrictions that are going to be on your shoulder? Well, you're going to come in, you're going to have the operation. With labral repair surgery, I'm actually fairly liberal with what I let you do. So I'm okay with the arm being down in here, actually even getting up into these areas here. What we don't want is big stretches in any plane because that will stress the repair. The anchors that we use for this surgery are actually very strong. The pull-out strength is 50 to 60 pounds, but you don't want to push the limits. And also you're going to be restricted a little bit by your own pain. So just know that all this stuff down here is perfectly fine, even the day after surgery. And then each week, each month, we will progress how much we let you move your shoulder and how much we let you lift with your shoulder. At the 3-month mark, we're going to let you start, getting back to weightlifting and training. Full contact type sports and things like that, we typically wait around 6 months. That's the standard. So early on, you can feed yourself, dress yourself, use the restroom, all those things without any risk of damaging the shoulder. It's really the weight bearing that we try to hold off on, and try to keep that light, less than 5 to 10 pounds for the first month or two, and then you can slowly progress up to where at 3 months we say, okay, now it's back to getting back to lifting. Even then, you're going to have a stiff, weak shoulder because you've been restricted. And with labral repairs in general, I actually like the shoulder to be a little bit tight because that's the problem we're addressing is instability. The ball and socket is unstable. So by tightening everything up and then slowly stretching you out, we'll create a nice stable ball and socket with and allow you to lift and use your shoulder and really do the stuff you need to do without having the pain you're having. So physical therapy is a big one. You for sure will do physical therapy after the surgery. Pain meds. So, we do several different tiers of pain meds. We have started doing Lyrica, which is a nerve medicine. We do ibuprofen, max dose ibuprofen for the first, at least 1 to 2 weeks after surgery. And I tell patients take that baseline unless you have some sort of contraindication, because ibuprofen doesn't cause nearly the number of side effects as some of the other medicines do. And we use typically tramadol, which is a lighter pain medicine, and then give the hydrocodone, the strong stuff. We also typically do doxycycline, depending on if your insurance will approve it. That's an antibiotic, but it's actually an anti-inflammatory. So we do several tiers of pain medicines, and to try to treat you with a multimodal approach. You also get a nerve block. Typically patients, and this is your choice to whether you want to do this, but the anesthesiologist will talk to you about doing a nerve block to where you don't feel anything for the first day or two after surgery. And that just gets you, just buys you a day or two from the most difficult part coming out of this is the first couple days, honestly. And then after you get through that, it's really not that bad. Other questions we get are about work. So, I tell patients just take the week off of work. I mean, surgery is a big deal. It's stressful on your body, and it's also stressful on your mind, right? That's one thing that I really didn't Well, just speaking from experience, right? Like I've gone back to work very quickly after this surgery before. Back when I was a resident, when I had it done the first time, and you can do it, but it stinks, right? Because you're just, just the stress on your body and mind to have an operation done, and then to try to have to go think and perform and all that stuff is really difficult. And my advice is like, we do surgery on Tuesdays and Wednesdays. Just take the week off. Just let your body heal, let your mind rest. The week after that, go back to work and schedule like a light week, and just see how you feel. And if you feel awesome and you're like ready to rock, then like go crazy. But just take the week off, schedule a light week. Just take my advice. You'll be glad you did that. Travel, I put no restrictions on travel with shoulder surgery. You can travel the day after surgery if you want. I mean, you're going to have a sling. We do have you wear the sling for the first week or two in public, just to kind of protect your shoulder, let everybody know you had surgery. But after that, it's kind of totally your call. And with labral repair surgery, if you never wear the sling, that's fine with me. Like I don't really care if you wear a sling. It's probably a good idea. Just you'll want to wear it for the first week or two at certain points because it'll just make you feel safer. But really after the first week or two, it's totally your call. You don't have to wear it because the labral repairs don't get stressed unless you stretch your shoulder in really, really difficult planes or you load your shoulder with really, really heavy weights. And so as long as you don't do those things, you're not going to tear the repair, you're not going to damage anything. But it is nice for that first week or two just to be like, hey, I had surgery, that's why I'm wearing a sling, so don't pat me on the shoulder. Driving, you can drive right after surgery. The nerve block's not going to allow you to use your arm, so after that nerve block wears off and you can start to move your arm actively. And you feel comfortable driving, drive. You can't drive when you're on strong narcotic pain medicines like hydrocodone because that's like drinking and driving. But if you're not having to take those, then don't drive. And also too, the pain medicines, again, there's certain medicines we want you to take, like the Lyrica and ibuprofen baseline, but the tramadol and the hydrocodone, if you never take one of those pills, that's perfectly fine with me. Like you don't have to take any of them. We do like you to have them as a backup because this surgery does, it is uncomfortable for the first week or so. So it's nice to have it there as a backup. But if you never take one pain pill, that's fine with me. That's fine with me. The dressings after surgery. So, we do arthroscopy through little poke holes in the shoulder, right? So we make little poke holes and then we insert a camera into your joint. And with labral surgery, we use little anchors to repair the tear. So you'll have dressings on your shoulder that are waterproof, so you can shower the night of surgery, the day of surgery, evening, the next day, and then 2 days after that, we say take the big dressing off and just put Band-Aids around your shoulder, and you can shower and let water run over it, but no soaking in any pools or tubs, because if water were to get inside those incisions before they've healed in the first week or two, they can cause an infection. So we that's something we really want to avoid. We go to extreme lengths to prevent that. It's really rare, fortunately, with arthroscopy, but even then, not a good idea to soak in any pools or tubs, but it's perfectly fine to let water run over your shoulder. And again, just cover the portals with Band-Aids after that second day. And if the Band-Aids get wet, just replace them. Just replace them. And you really don't even have to put Band-Aids on there. It's just nice to have because there's little stitches, they can irritate you. So it's nice to have something smooth to cover them. Some questions we get to is clicking and popping in the shoulder. You may feel some clicking and popping after the surgery. Some of this is scar, some of this is fluid. And as long as it's not causing pain, don't worry about it, right? Some of that's just your body kind of working things out. And if it is painful, then you need to let us know. We need to take a look at things. But if you feel clicking and popping in your shoulder, the body is, we basically use scar as a tool in surgery to repair things that are torn, right? So we have something that's not where it should be, and then we put it back, and we're relying on your body's natural healing mechanisms, which is scarring, right, to put things back. If you think about, when you cut your skin, it heals together with scar. So scar is very, very useful for a surgeon to fix things. But sometimes the body puts too much scar around places, and so that's why you can have tightness, which we kind of want, but not too much. But we also, sometimes that scar can cause some clicking and popping, but as long as the clicking and popping isn't painful, do not be concerned and just know that that's natural and normal, and it typically goes away. But it can take 6 months to a year for that clicking to go away. Even if it never goes away and you don't hurt, I would not be overly concerned. How painful is this surgery? Well, everybody's different, right? And we track all our outcomes very carefully. and it's all across the board. I mean, some patients come in, they have the surgery, and their pain goes down immediately. Some patients have a spike for the first week or two just from the surgical pain of doing a procedure, and then everything in between. What I try to coach people to say is like, listen, like I wish that I could predict exactly how every patient is going to react, but it's really interesting when you look at the data, look at the numbers, how different people are. We just go to extreme lengths to try to minimize it, right? And I think, doing the surgery in a minimally invasive way, using the smallest anchors we can use, and doing the surgery efficiently, we know that helps decrease your pain, right? The way that we do the surgery. But again, everybody's different. So try to focus on the long game and where you're going to be in 6 months to a year. And that consistently is very, very good, right? Like you're way better than you were before surgery. We have excellent outcomes for this procedure. You have 95% success rate. So I would not, listen, I get it. You're scared because you're having surgery and it's a big deal and you shouldn't think of it as a big deal, but just know that the pain is manageable for the vast majority of patients, even in the worst part, which is like the first 3 or 4 days. You'll be uncomfortable, it'll be annoying. There will be some nights where it's achy and sore, but just take your medicine, ice your shoulder down. That's another thing too to bring up about pain relief is, take the medicines, but ice the shoulder down 3 to 4 times a day for about 15 to 20 minutes. That's gonna really help decrease inflammation and pain. And there's no risk to icing. There's no risk, right? Don't love heat in the first week or two. I think ice is better. So that's something to think about. But we'll send you home with some ice packs from the hospital. People ask about using those big coolers. I've used them, they stink. And they don't get insurance, they don't get reimbursed for insurance anymore. So they're great for knees just because of how easy it is to put it on. But trying to manage getting that thing on there when you've had surgery, and then like all we do, we just give you like basically the exact same thing. It's a big sheet of like ice pack, but it's like big, it's like this. And so you just cover that, it does the exact same thing, and it's free, we give it to you, and you can use it as much as you want, and it's way easier. So, but I love ice because ice, if you're using ice to take care of your pain, then you're not taking as much pain medicine, which decreases a lot of the side effects that we have. One of the big things that people have is nausea too after surgery. So that's another thing that I should have brought up is, we give you anti-nausea meds. And we also give you those meds during surgery to try to prevent nausea. So that's baseline. Everybody gets that. That's part of your prescriptions, because we just know that that's one of the most common things people fight for the first few days is nausea, just from all the medicines we have to give you to put you to sleep and get you through the operation. And again, we try to minimize how much of those we give, but we have to give you some pain medicine to do surgery. So, nausea is just something that people get for pain medicine. So we try to minimize that. What's your full return time? 6 months to a year really is how long it takes people to get completely over labral surgery where all their strength's back, all their mobility's back, and we're maximized. Our average outcome for these surgeries is around 90 to 95% of normal. That's how patients rate their shoulder. If you look at our average rating of the shoulder before surgery, it typically is, below 70% and typically like in the 50 to 60% range, where the patient says, we ask you that question, how do you rate your shoulder for pain, function, strength, all those things? Most patients are around 50 to 60 before surgery. After surgery, they come out 90 to 95%. So I wish we could make every surgery so that people's shoulders were perfect, but what we have to accept in this current time is that we're very good at making you way better. And also what I want to hear, or what I consider a success, is when the patient says, listen, doc, I'm way better than I was. I'm really glad I did. Like if you say those things, then that means that the surgery was a success. How successful is it? Everybody's a little different in terms of how far they can push it. But the vast majority of our patients are able to get back to very healthy, active lifestyles and do a lot of the things that they couldn't do before the operation because of pain. So that's our main goal. What are the anchors made out of? So we'll show you, we video every surgery start to finish. And I take a full live video and I have it saved in a cloud database. It's pretty awesome because I use it to study and learn and teach and all that stuff. But we use little anchors made out of suture, right? So they're basically, you make a small hole in the bone and it's like a 1.9 millimeter hole. We drill the bone, we set the anchor, and when you pull back, it's like a drywall plug. It sets in the bone. They're incredibly strong and they're also tiny. Like the hole we make in the bone is small, so patients hurt less. They have less pain with these anchors than they do with the more plastic screw-in anchors. Sometimes, if we're going to tenodise your biceps, we may use one of those little plastic anchors. But again, it's the smallest one we can possibly use, and that plastic actually grows into your bone. So we use either sutures, or we make anchors. We use anchors made out of suture, all suture anchors, or we use tiny little plastic ones to fix your labrum. And they work well, and everything just kind of grows into your bone, so it stays in there. It doesn't set off metal detectors because there's no metal. How long is the procedure? It depends on how many anchors we have to use and the complexity of the procedure. So, depending on your tear, sometimes we use 1 or 2 anchors. Sometimes I've used 10 to be able to fix people that have just huge tears in their labrum, and then everything in between. So I tell people 30 minutes to an hour is typical, just depending on how many anchors we use. It's rare for us to go over an hour now. We've got great tools. I've got a great team of people surrounding me at all of our facilities, plus my associates that operate with me. I always do the operation. That's a question we get sometimes: is, are you going to do the surgery? Yes, I'm doing the surgery. I'm the surgeon. I do the surgery, but I have assistants helping me, which really helps our quality, really helps our efficiency as well to do the operation in a clean, efficient manner. Outcome scores, again, so you make sure you fill out all your outcome scores with our databases. It's incredibly important that we track that so we can learn honestly about our patients and the surgeries we're doing and trying to get better, and that's huge. So and again, our outcomes that we said before is typically 90 to 95% of our patients rate their shoulder higher than 90%. Typically, I say between 90 and 95% is what we see the patient saying their shoulder is at like 6 months to a year after the surgery. Permanent restrictions, so really no permanent restrictions with this. I want you to get back to everything. With labral repair surgery, it's typically a younger demographic. Every once in a while we'll have patients, in their, 50s, maybe they get a labral repair, but it's mostly 50 and under. So it's very active, healthy people that are still like kind of pushing it. But my goal is to get you back to everything, right? Like get you back to lifting, getting you back to sport, getting you back to, so the shoulder doesn't hold you back. I mean, that's why people are having this procedure done, is because they've tried physical therapy and they've tried conservative measures, and the shoulder doesn't allow them to live the life that they want. And so that's why we do it. I mean, we don't do the surgery to sit there and say like, well, don't go do all these things afterwards. Like, why would you have the surgery done? If that was the case. So that's the goal. That's the goal. I think that pretty much covers it. So excited that you're going to get this done, and I hope this video answered a lot of your questions.